Hello, everyone. Welcome to our QFix Training Hub. Today, we are diving into operative reports and surgery text field. Might sound daunting, but I promise you, no need to scrub in for this one. Let's break it down together. Ever tried reading an op report and thought, is this English or a secret code? Let's decode this together. Op reports are crucial for documenting surgical procedures. They ensure accurate patient records and inform future care. Most errors are made in this text field. When documenting, we have specific instruction on how to document these fields correctly. There are do's and don'ts when completing the op report text fields. Let's get into the do's. Read the entire op report. Record information that support primary site, extension of disease, tumor size, or stage if applicable. Now let's get into the don'ts. Do not add pathology report information in this text field. Do not copy or paste surgery text into the op report text field. Here's an example on how to properly document in the op report text field. All right, guys, let's get into the surgery text field. The surgery text field is primarily used to back up surgery codes. The text area is for information describing all surgical procedures performed as a part of treatment. It's essential to include details like the date of surgery, the facility, the type of procedure, and the lymph node status. Here's an example on your left. All right, guys, let's break down the difference between operative report text and surgery text documentation. Don't worry, it's not as scary as it sounds. Think of the op report text like reading a whole intense chapter in a medical mystery novel. You've got to read the whole entire thing. There are unexpected findings, surgical steps, and even personal notes from the surgeon, kind of like their journal entry for the day. Example, their diary. Today I resected a mass. On the other hand, the surgery text field is your go-to for summarizing the important stuff like the lymph nodes, surgical approach, margins, and whether the patient made it out okay. Basically, it's your concise, power-packed summary. Think of the cliff notes of the cancer surgery, just the crucial stuff to back up the codes. And remember, behind every abstract is a real person's story. So let's document with accuracy, heart, and a little humanity. Now, guys, for the fun part, let's get into a few case scenarios on op report and surgery text fields. Here are a few case scenarios. For example, a 65-year-old patient underwent attempt operative resection on June 24, 25 at Metro Palace Hospital. Intraoperative findings revealed extensive disease within the pelvis, carcinomatosis throughout the abdominal cavity. Resection was aborted due to numerous peritoneal and mesenteric implants, making surgical removal non-viable. No gross resection achieved. In this case scenario, which of the following best reflects how this should be documented in the op report text field according to NACER standards? Is it A? Is it B? Is it C? Or is it D? The correct answer is D. On June 24, 25, at Metro Palace Hospital, attempted pelvic resection aborted due to carcinomatosis and extensive peritoneal mesenteric implants. No gross resection performed. Why is D correct? It includes full date, facility name, surgical intent and outcome, findings from surgery, for example, extent of disease, clear documentation of no gross resection and why surgery was aborted. John Doe presented with elevated PSA levels and was referred for diagnostic evaluation. On January 2nd, 2024, the patient underwent a transrectal ultrasound-guided prostate biopsy at Dr. Spirit's office. Biopsy confirmed adenocarcinoma of the prostate. Following diagnosis and multiple disciplinary evaluation, the patient proceeded with definitive surgical management. On January 1st, 2024, John Doe underwent a robotic assisted radical prostatectomy with bilateral pelvic lymph nodes dissection at Champion Hospital. The procedure was performed without intraoperative complication. Pathology later confirmed organ-confined prostate cancer with negative margins. Based on this case scenario, which of the following is the most accurate and appropriate entry for the surgery text field according to NACER standards rule? Is it A? Is it B? Is it C? Or is it D? The correct answer is C, January 2nd, 2024, at Dr. Spritz's office, prostate biopsy, January 17, 2024, at Champion Hospital, robotic assisted rad prostatectomy with bilateral pelvic lymph node dissection. Why is C correct? It includes both dates with for formatting, lists procedures type and location for each. It also uses medical abbreviation acceptable by NACER, for example, biopsy, lymph node, and rad prostatectomy. It also includes the lymph node status, example, lymph nodes dissection. And last but not least, it clearly documents outcome for both procedures using concise, relevant clinical terms. Well, guys, we have come to our conclusion. That's all I have to say for surgery and op text field. I hope you now understand it better and feel ready to do a fantastic job when entering the correct information in the surgery and op report text field. Remember, detailed and accurate documentation can make all the difference. Let's turn these medical mysteries into clear, concise reports, one fill at a time. Until next time, stay sharp, stay detailed, and stay awesome. Bye. There are do's and don'ts. When completing the op report, I know I said that. Let's break it down together.